I see that we're now live. Good
Yes.
evening. Good evening, everyone. We would like to acknowledge that we are conducting our business this evening on the traditional territories of the Tsimshian, Gitxsan, Haisla, Niska, and Wet'suwet'en people, and we feel honored and privileged to be able to do so. Thank you for joining us in our town hall Q&A session this evening. And business this evening on the traditional territories. Oh, there's a lag. Is there supposed to be a lag? Sorry, Andrew. Okay, thank you. Thank you for joining us, and we look forward to answering some of the questions that have come forward from community members, parents, guardians, and people who are concerned about children going back to school within our district. My name is Charm McCrory. I'm the Board of Education Chair, and I'm a trustee from Hazelton. We are pleased to co-host our event this evening with members from Northern Health and the school district's District Parent Advisory Council, or DPAC. We will start by doing a round of introductions, and I'm going to start by calling on my fellow trustees to introduce themselves and say where they represent from. So we'll start with Trustee Warkup.
Oh, and there, I'm unmuted. I'm Margaret Warkup, and I'm the trustee from Terrace.
And Trustee Erasmus.
I'm Art Erasmus, and I'm also a trustee from Terrace.
Trustee Raj.
I'm Raymond Raj, trustee from Kitimat and the vice chair of the board, and I'm completing my 12th year this year as a school trustee.
Thank you. Trustee Watson, I believe you're still on. I don't see you though.
Hi, I'm Trustee Watson, or Sandy Watson, and I am the trustee for the Thornhill area.
Thank you. Next, we'll go to Rachel Pozo.
Good evening, I'm Rachel Pozo, and I am the secretary of the District Parent Advisory Council and on the Parent Advisory Council for Magical Lake Aliacs in the Hazeltons.
Thank you. And next, we'll go to our Northern Health team, and we'll start with Allie Moore.
I'm Allie Moore. I'm an environmental health team lead.
Okay, we'll go to Dr. Kling next. We'll come back to Raina.
Hi, my name is Dr. Raquel Kling. I'm one of the medical health officers for Northern Health. And Shar, I think you were talking on mute for a second.
Thank you for that, Dr. Kling. Dr. Fumerton, would you like to introduce yourself?
Sure. Hi, everybody. My name is Dr. Raina Fumerton. I'm the Northwest Medical Health Officer. So I cover the Northwest Health Service Delivery Area, and I'm also the acting Northeast Medical Health Officer, covering that health service delivery area. Dr. Kling has kindly agreed to provide the lead on this call from the medical health officer perspective, just because I'm at home with 2 sick kids myself here. So they're quite distracting, and I didn't want to take away from the smoothness of this meeting and whatnot. So I'll be listening in the background primarily. I may be able to participate to some degree, but largely I just very grateful to Raquel, and also really want to be able to listen as much as possible and learn about what the questions and concerns are and the issues. So appreciate being part of this session. Thank you for inviting, and thank you for hosting.
Thank you so much, and we wish you well with your kids this evening. We're going to go to Trustee Yonkman, who has joined us. Trustee Yonkman, could you please just introduce yourself and where you represent?
Yeah, hi, I'm Karen Yonkman. I'm the trustee for Kitimat.
Thank you. And finally, I believe on our panel, we have our superintendent of Coast Mountain School District 82, Janet.
Thank you, Trustee McCrory. My name is Janet Meyer, and I'm the superintendent of Coast Mountain School District.
Thank you.
Hi,
So
Shar.
we'll
I'm here too,
Oh,
Shar.
oh, I'm sorry, Angela. I didn't know. Go ahead, Trustee Denuser.
Hi, I'm Angela Denuser. I'm trustee representing Stewart.
Thank you for that. So we have all of our trustees present, which is wonderful. And we're going to start our session initially by an introduction from our various partners. And then we're going to go into the questions that have been provided. So we're going to start with an introduction with Dr. Kling.
Hi, and thanks for having me today. I just, want to mention, I know that this is a very confusing time and everybody's very anxious about going back to school. I just want you to know that, we're here to support going back to school and, promoting health and providing advice at school to make this as smooth as possible. Yeah, that's about it from me.
Thank you. Thank you for that, Dr. Kling. And Rachel from District Parent Advisory Council.
Sorry, it takes me a minute to find my mute buttons. So I am Rachel with the DPAC for the district. So the District Parent Advisory Council is made up of PAC members from individual schools. And what DPAC does is act as a liaison between the PACs and DPACs. And really, we get to act as the parent voice at the table. So when there's information being communicated to and from PACs from the district or issues that need to be brought forward, we are the parent voice at that table. We're the only group that is there and not paid, and there specifically to advocate for our students. And we are able to give input into the development of educational policy. We are all elected from our individual PACs, and recognizing that there will be some changes this year, things are looking very different. So like everything else in the world, both parent advisory councils and DPAC will look very different this year. So we're not maybe having the usual welcome barbecues and bake sales and those sorts of things, but it will be a vital role this year. And there may be some parents who are unable to continue in their roles because they may be choosing options other than sort of brick and mortar. So we'd really like to take this opportunity to encourage parents who maybe haven't been involved previously at the PAC level to come forward and assist with your schools and perhaps make the commitment to work with DPAC for the year. We are running on a very, very short string of people. There are, I believe, 2 of us at the moment, and some help would be appreciated. So please get involved. And I just wanted to say from the parent perspective that we know people are making really, really difficult decisions this year and struggling with tough choices. I just wanted to say that no matter what the choice is, no matter what the decision is that you make that's right for your family, and no matter what the decision is that you make in terms of schooling this year, it will be the right one for your family. There will be support for you. There will be support from district employees and staff at your school, support from your PACs and your DPACs and the parents in your communities. So make the right choice for yourself, and there will be support there. It will be a challenging year for certain, but I think working together that we'll be able to make it a successful year. Thank you very much.
Thank you for that. And I'm thinking, did I miss Trustee Erasmus in the introductions? No? Okay, good. Okay, we're going to go on to our superintendent. Janet, for an introduction, please.
Thank you, Shar. Yauts, Amasa, Amahil. As mentioned, my name is Janet Meyer. I am the superintendent of schools for Coast Mountain School District.
That's all right.
I'd like to first, before I start my official introduction, recognize the contribution that DPAC has made over the past 4 weeks. Both Rachel Pozo and Crystal Miller have met with me on a weekly basis, and we have discussed questions that parents have brought forward, and we have discussed options, and their input has been extremely valuable, and I'd like to recognize that and thank them for that. Now, I would like to acknowledge and convey a sense of sincere appreciation of how difficult it must be for parents at this time. Additionally, I would like to acknowledge the anxiety that comes for our staff with September 2020 and the start of school quickly approaching. Here's what we want you to know. We want you to know that the safety of our students and staff is our #1 concern. We want you to know that we created a district plan based on the parameters provided by the provincial health officer and the Ministry of Education. Our plans were approved. We trust in the expertise of the medical professionals in our province who have set out the parameters that we have based our decisions on. We want you to know that we have safe plans that will see our schools welcome students back to in-class instruction next week. We want you to know that we have based our work in August on maximizing in-class instruction within the parameters referred to earlier. Additionally, we've invested over $400,000 so far in additional hand washing stations, personal protective equipment, which including face masks and shields. We have purchased, or we are providing additional custodial supports. We are providing buckets upon buckets of hand sanitizer, and we are providing directional stickers that you will see throughout every school. Our goal is to have as many students attending full-time as possible, as soon as it is appropriate for them to do so for their family, based on their own unique circumstance. So to that end, I would like now to review with you and share my screen to offer an explanation around the 3 choices for parents when it comes to educating their children. One moment, please. Shar, can you indicate that you can see that graphic, please?
Yes, I see it. Thank you.
Thank you very much. So this graphic, as you know, has been on our website since the midway through August. And you will see that there are 3 options, and these are not 3 new options for parents in British Columbia as it relates to educating their children. These have been the options for parents for a very long time, and they involve homeschooling. And I won't read to you, but homeschooling is an alternate method where the parent assumes all of the responsibility in the delivery of the educational program. So parents who choose homeschooling are required under the School Act to register their child in any school in British Columbia as a homeschooled student. And they do not need to register their child in their neighborhood school. They simply have to be registered in a school in British Columbia, indicating that they are homeschooled. After that, the parent is responsible for the curriculum. The parent is responsible for the delivery of the curriculum. And it is also worthy of note that families that have students in grades 10 to 12 cannot opt for homeschooling because students cannot graduate from British Columbia with a dogwood from the homeschool stream. Option number 2 is the distributed learning option. And for those people who may have hair of a similar color as myself, you may recall that or see that option more as it used to be called correspondence school or distance learning. It is now called distributed learning, and it is the second option for parents. We have a distributed learning school program, in our school district, and that is North Coast Distance Education Program. And we have restarted our K-9 program for those families solely in our school district who feel that distributed learning would be the best option for their children. And I know that anyone who has indicated an interest in distributed learning and has signed up on our NCDE website has received a call from Mr. McKay, who is the principal of that school. And thirdly, I recognize that I'm going backwards. Option number 1 is the brick and mortar traditional school option. That is the option that most people are used to. That is students attending their neighborhood school unless they are a cross-boundary student. And that is our hope, is that we can maximize our instruction in the brick and mortar traditional school method. So that is what's been on our website for some time now. And some of you may recall that on August 26th, the Minister of Education, the Honorable Rob Fleming, had a press conference. And at that time, the Honorable Rob Fleming indicated an expectation to school districts that school districts were responsible to provide a flexible program for families who maybe don't necessarily fit in the box of distributed learning or homeschooling. They think they want to go back to the brick and mortar system, but they're just not quite ready. So the Honorable Mr. Fleming very clearly indicated that districts were responsible to provide a flexible option for those people. And for Coast Mountain School District, I will now share with you what our optional flexible plan would be. Now, this graphic that you see in front of you covers in the bottom left, you can see that there's still the homeschool option. There's still the distributed learning option. And then there is the first option, which is the brick and mortar. So you can see the line in orange, which is the full-time in-class attendance. What we have done in Coast Mountain School District is developed an alternate back-to-school plan for parents and guardians of students in kindergarten through grade 9 who are not quite comfortable sending their children back to school right away for whatever reason. There are many extenuating circumstances with families and elders that cause families to want to rethink when they send their children back to school. These are extremely challenging times, and we understand that some families need more time to become comfortable with the safety procedures implemented by schools. So we have created the Learn from Home transition option. And that is the line that you will see in blue. And you will see that over time, the blue line merges into the full-time in-class instruction. So the new transition plan that we are offering will have students remain enrolled in their neighborhood school and start the school year from home before transitioning back to the classroom. And for different families and for different children, that will look different. To clarify, however, this is not a fourth option. This is a subset or an extension of the full-time in-class attendance. This is not a remote option. Well, for some time it will be a remote option. It is not a hybrid option. Those are no longer options. Those were options in the spring. Now we have homeschool, distributed learning, or brick and mortar with the Learn from Home transition option. There's some important factors that parents need to be aware of when considering this transition plan. This is a temporary plan intended to keep students connected to their school. Students would work on literacy, numeracy, and core competencies. This will not mirror the classroom. This will not be provided by what will be the classroom teacher when the student transitions back to school. This service will be provided by temporary teachers on call. And again, they will focus on literacy, numeracy, and the core competencies. Families will still be responsible for supporting their child's learning at home, and there will be weekly check-ins with the transition program teacher. It is the school district's expectation that by the end of October or early November, that those two lines will merge and students will have already transitioned back into school. Some students may take a short period of time to transition back to school, and some students may take a longer time. But it is our hope that by the end of October or the beginning of November, that students will have transitioned back. So as we entertain many of the questions this evening, there are many questions that highlight the need for a flexible option. And this is Coast Mountain School District's response to that need. It is called the Learn from Home Transition Option. Students remain enrolled in their neighborhood school and they transition back when it is appropriate to do so according to the needs and the challenges of their own family. So I trust that that clarifies the options for people. And having said that, I will
Janet?
proceed. Yes, Trustee McCrory or Chair McCrory.
A question for you about the Learn from Home transition option. Should a parent be interested in that option for their student, their child, how do they go about? Do they phone the school and let them know? How do they go about that process? And how are you sharing that out with parents?
This option is now live on our website, and schools will now reach out to families who were unsure of what path they might take, and they now will be made aware of this option, and they can communicate directly with their school principal or vice principal via email, or they can call the school and have a conversation with the principal and or vice principal.
Thank you. And one more follow-up question. Should somebody, a family, have chosen full-time bricks and mortar in-class learning initially and is only now being made aware of this other option, can they change their mind on what they've already told the school they're planning on doing?
Absolutely. That is within the right of a parent to decide what is best for their students. And if someone has chosen distributed learning and now wants to do the Learn from Home transition option, they are more than welcome to do so. We have adopted since the beginning, since we were told that we were going to go back to school in September at stage 2, we have very much adopted an exercise of time and patience. And we have purposely not pushed our families to make decisions that they weren't ready to make yet. And that still holds true. And so families are still able to make a choice based on what meets the needs of their families the best.
Thank you for that. And they can view this chart on our website, correct?
That is correct, yes.
Okay, thank you. So,
and I think, sorry.
Are we going into questions now that
we are?
Provided?
We
okay,
are. I just hesitate to leave this graphic without addressing the homebound education, and because there are families who may consider themselves that they may need this. But I would like to address this by saying that most children who are immunocompromised can return to in-class instruction when safety measures are in place. Protective self-isolation is only recommended for children who are severely immunocompromised as determined on a case-by-case basis. So thank you for that, and now we shall proceed to the questions.
Okay, thank you. Go ahead.
The first question, at this point, I do not feel comfortable sending my children back to in-person school. We have immunocompromised family members as well as older grandparents who are very involved in my children's lives. I am leaning towards the distance education plan that is being offered by the school district. However, I would like to know if things change and I decide that in-person schooling would be better for our family, will my children have a space? And that question can be answered as follows. When students are registered in a school, students can only be registered in one institution in the province at any given time. So if a student was enrolled in distributed learning and chose to return to their neighborhood school, they do not have a space in that school. There may be space and they can re-enter that school. And one would hope that given our circumstances that there may be space in all of our schools, that student could return. But there is no guarantee that when you transition from distributed learning to brick and mortar, that there's no guarantee that there will be space in your neighborhood school. You can't be enrolled in two schools at the same time. And the second part, according to the latest update provided by Minister Rob Fleming, it sounds as though schools are meant to be flexible and allow transitions. And yes, that is correct. And that is addressed clearly by our transition plan that I outlined. Next question, why is the district not changing class sizes to comply with social distancing standards? As I mentioned in my opening, we take our direction at the school district from the provincial health officer and the Ministry of Education. And it was very clear in the guidelines that we were to focus on cohorting students in cohorts of 60 or up to 120 for older students, and that reducing class sizes was not one of the mandates that was outlined by those two organizations. When students are in cohorts, there is no requirement for them to physically distance. If the group that is in my office with me now, we are our cohort, we are not obligated under the operational guidelines or the health and safety guidelines that have been provided to physically distance from one another. Now, when we choose to, or when it becomes necessary for us to interact with someone from a different cohort, then we need to engage in physical distancing. And if we can't physically distance, we wear a mask. Question from Steve. Where do our kids go if they do get infected at school? Because they bring it home to family members that could be compromised already. Some parents may have underlying health issues. How can the school board guarantee the safety of families that are going home to and risk on making other people sick and more spread? So Steve, thank you for the question. And from a school district perspective, and I will invite Dr. Kling if she chooses to weigh in on this question, there are no guarantees, and I cannot offer you any guarantee that I can't guarantee that no one in our community will get COVID-19. Any further comments on that?
Yeah, thanks, Janet, and I appreciate you saying that. It's true. We know this is very anxious times, but we can't guarantee that there won't be COVID in your community or in your school. It's possible it can happen. So that's why, following all the preventive measures and advice from Dr. Henry is so crucial when going back to school. So to me, the most important thing to do is doing that daily symptom screen and not going to school or work if you're feeling any symptoms at all, and just staying right home. That's our best line of defense right now. That's followed with, frequent hand hygiene. We know that, people touch their face, their nose, touch everything else. That really contributes to spread germs. So by frequent hand washing, that really will decrease the spread of germs. And again, that's also why masks are being required in certain situations. That again helps to reduce the spread of droplets. So we hope everyone can do their best to follow all guidance, and that will reduce the spread, but we know that it won't stop things entirely.
Thank you, Dr. Kling. And a few questions from Sam. And the first one probably will be a Northern Health response. I understand that if a child is If a child is sick, they must not attend school. And if symptoms show during the day, the parent will be called to pick up their child. But what if they have symptoms of a cold, such as a stuffy nose? Do they need to stay away for 14 days? Or once they are feeling better and get cleared by a doctor, can they come back? And there's more. A cold usually lasts just a few days. Basically, I'm asking if any and all sickness results in 14 days off of school. My daughter gets chronic ear infections and it gives her a low-grade fever for half a day to a whole day sometimes. If she goes to see a doctor and put on antibiotics, can she come back when she's feeling better?
So I'll try my best to hit all those parts of the questions.
I'll help you along.
Thanks. So first of all, any child with a pre-existing medical condition like asthma, allergies, anything that gives symptoms that might seem like COVID, it might be useful to ahead of time have that documented by a physician and maybe get a letter ahead of time. Any children experiencing usual symptoms of their usual conditions will not be required to get tested or to isolate. It's only if those symptoms change. What happens if a child has a new symptom or something different? We would expect, like you guys outlined, a child would be isolated at school, a parent would be called, and then we would really recommend that children get tested for COVID. If a child tests negative for COVID, they can return to school when they're starting to feel a bit better. That's also important that perhaps a child can get evaluated by a healthcare practitioner so they can rule out another explanation for the illness. For like an ear infections is a great example. If a child is diagnosed with ear infections, something that's clearly not COVID, then again, once they're feeling better, they can go back to school, and feeling better can be determined by the parent. If a child does not get tested for COVID and there's no other explanation for what might be causing the symptoms, and that can include cold-like symptoms, because we know that COVID does prevent with cold-like and flu-like symptoms, that means a child should be staying home for 10 days if they're not tested.
Thank you, Dr. Kling. So what you said something very interesting that we had not discussed yet, and that is if a student has a chronic condition that may present symptoms that may be similar to COVID-19, it would be wise for a parent to take the child to get that chronic illness documented.
It's just a suggestion, it's not a requirement. But just hearing some concerns from other schools and school districts that teachers might be fearful if children are having symptoms, and parents know that it's usual symptoms of a normal condition, it just might help alleviate fears in the setting to have it documented and given to the school.
Thank you, that's a great suggestion. And a further to that question from Sam related to her children, if the child that has that issue gets sent home with a fever, is she also required to pull her other children out of school, even though he is not experiencing any symptoms?
No, anybody that is well should still be going to school. It's just the person that's sick that should be staying home.
Thank you very much. And Sam's last question is, how will the children be able to keep up on their work if they're off of school while sick? In high school, we're doing the quarter system. So if a child misses a week, that's a huge chunk of learning. So the response to that is very similar to any previous year that we've had in our school system. When a child is sick, that each school has a process for requesting work for the student so that they keep on top of their studies. And that process, we would follow the same process. Thank you. Question from Sunny, and it might take a second to get to the question. I don't think it's wise to open schools this year. I get that education is important to teach, but it is in everyone's best interest to expose our children in public while fall is upon us and COVID-19 is still a big impact on our communities. We've gotten lucky without a huge outbreak in our small communities, but that's because we followed the procedures in this global pandemic. I'm not willing to risk my children's health because of extra cleaning. Can we have a better option to educate our children from home? And again, thank you to Sunny for the question. The three choices that we outlined at the beginning of this town hall are the three choices. There is the add-on to choice number one, which is brick and mortar, which would allow you the wait and see option. So Sunny, you're welcome to put your students in the transition program and wait and see until it's such time as it's appropriate for your family and your children to return to school, and then you can make a decision that is in their best interest. And this question is from Catherine. I am a single mother with toddler in daycare. I anticipate she will be getting sick often because that's how it goes as she builds her immune system. The daycare policy is that if she has a cold or flu symptom, she is not allowed to attend daycare. She may return after 14 days of self-isolation and presenting no symptoms, or she gets a negative COVID test. I am a primary caregiver and so will be the only person required to stay home with her. I will then have to use family illness days for this, in brackets of which we have a few, and sick days. As I can see, I will be having to take many days off without pay because of these circumstances. I am sure there are several other teacher parents in a similar situation. So her questions are teachers going to receive either more paid family illness days or leniency with how we use our personal sick days for those of us with children in school or daycare, or perhaps a separate leave option related to COVID? That's a great question, Catherine. We have, as you well know, we live by the collective agreement that is in place between the province of British Columbia and the School District 82 and the Coast Mountain Teachers Federation and the BCTF. And there are articles in there, you are correct, that limit your family illness days. I believe it's 6, and sick days. Your suggestion is a good one as to providing some flexibility for the use of sick days, but we do not have the latitude to adjust a collective agreement at this time. The second question is, will the health and safety regulations for daycares be changed to accommodate children of essential service workers? And I cannot speak to that. I don't know, Raquel, if there's anyone on your team who might be able to address that.
I also don't have any particular answers for daycare. Ali or Raina, I'm not sure if you're aware.
Sorry, the question was around what is the guidance for childcare settings?
No, the question is, will the health and safety regulations for daycare be changed to accommodate children of essential service workers? This question, Raina, it stems from a daycare requirement to self-isolate for 14 days if presenting with symptoms, or get a COVID test, which requires a requisition from a doctor. So this person is concerned about the amount of time that she will have to take off of work due to the regulations from the daycare.
Mm-hmm. Yeah, and I can certainly relate. I am in that situation right now with this little one. So the 14 days doesn't make sense to me. It should be 10 days. So it's the same as what's being proposed for schools at this point in time. So if your child has symptoms, the recommendation is that they get tested, and if you have a negative test, then you can go back much sooner. If you choose not to get your child tested, then it's 10 days from the first day of symptom onset, unless you have, as was described, a medical reason for the symptoms that can be explained by another condition. Again, these policies are what's in place at the moment, and so it's the same in terms of the requirements for being away, et cetera, for childcare settings and for schools. And provincially, they are looking at that, and you know, is that going to work? Is that sustainable? Is that practical for families? What's the right balance? You know, should children be allowed to return to school just once they're feeling better, just regardless of a test? And all that's being discussed provincially. And so certainly there may be shifts in the approach as we move forward and we learn more about how things are gonna go with school restart. And things can maybe changed and adapted accordingly. But at this time, the recommendations around this issue are equal for schools and for daycares. So I hope that clarifies that question.
Thank you for the clarification. And one more question from Catherine. Is the Northern Health Unit prepared for the drastic increase in the amount of tests that are going to be needed when kids go back to school? I know I am going to want my test done as soon as possible so my child can go back to daycare and I can go back to work.
Yeah, so first of all, we only recommend that people with symptoms get tested. We are not testing anyone without symptoms. But yes, Northern Health is working really hard to prepare for the extra testing that's going to happen, you know, coming up in September, and especially for children in schools. Yeah, we're working hard to make sure that their testing will be easily accessible for anyone that needs it. Just to note right now, we're just a bit backlogged. So if you do need a test through our Northern Health virtual clinic, it might take a little bit of time to get a hold of them. You might be on the line for 1 to 2 hours before talking to someone. So we're actively working to getting this solved. But yeah, just to note, it might be a bit of a wait to talk to someone at this time.
Thank you.
For what it's worth, experience like the wait at the virtual clinic right now is a bit long. So make sure your battery's charged on your cell phone. But once that was completed and the requisition was done, then the actual process of going and getting tested was very, very, very quick and very efficient.
Thank you for that clarification. Next question. In account of increasing COVID-19 cases throughout BC and confirmed cases in Kitimat, is the school board considering online classes for kids? This would reduce the risk of exposure and spreading the virus, and we are wishing to agree to any rules that will be put in place for online classes. Thank you. Thank you for the question, and we take our direction from the Ministry of Education and the Provincial Health Officer. And the directions we were given were to design a stage 2 plan that would maximize in-class instruction. So at this time, the answer to your question, thank you very much for posing it, is no. Our goal is to have as many students back in class as possible in an extremely safe environment. Next question from Liz. Thank you for providing an opportunity to provide feedback on this year's COVID return to school plan. I am wondering if our school district could provide some remote learning options for students as part of the classroom program. I think it would be better for classroom and school configurations to have students registered at their school in the beginning of the year, whether they will be doing remote learning or attending school in person. Perhaps schools could accommodate the wishes of what each family wants and their comfort levels. I am worried that families become disconnected from their community school this year. There is also the worry that the school year will be chaotic and returning students who have tried homeschooling and were unsuccessful. Thank you for your question, Liz. I believe that our Learn from Home transition program between September and the end of October will provide families with the flexibility that they are required. And again, as I outlined at the beginning of our town hall, that is a temporary measure and one that is not sustainable across the entire school year. And a question from Hillary. What are the options for students in grade 12 should they decide to distance learn after the school year has already started? My response to that, Hillary, is 10 weeks, 20 weeks, 30 weeks. So your child will be engaged in the quarter system, and they will be taking 2 courses for 10 weeks. At the end of that 10 weeks, well, first of all, I would suggest that your child, if he or she, if they start in the brick and mortar school, that they stay till the end of the first quarter so that they can accomplish or complete 2 courses. And then if they decide to transition to distance learning, then that would be the time to do that, and they would be welcome to do that. A question from Denise. Why aren't masks mandatory for all students? Clearly, social distancing can't be achieved, but masks help mitigate the spread of droplets. We take our direction from Dr. Bonnie Henry, the Provincial Health Officer, and the Ministry of Education. And there are certain circumstances where middle and secondary students are mandated to wear masks. And there are other times, particularly our younger students, are not required to wear masks. And I'd also like to say that the cohorting system, or putting children in cohorts, when they're within their own cohort, they're not obligated to physically distance within their cohort. It is only when they interact with someone from a different cohort, then that engages the thou shalt physically distance. And if physically distancing is not an option, then they are required to wear a mask. And again, Denise, this goes back to my original comments around the science involved in returning to school at stage 2 and trusting in the science. Question,
I just wanted to add about masks. They are a way of preventing the spread of COVID, and that's why there is recommendations for masks as part of the plan. But I just want to make it clear that masks are the very last line of defense in terms of preventing COVID. We talk about a hierarchy of ways of preventing COVID, and yeah, masks are our last line of defense. So while they can be helpful in certain situations, we shouldn't be stressing on masks as a solution. They are part of an overall big picture.
Thank you very much for that clarification. Another question is, will Windows
Janet, your sound is not properly.
Can you hear me now? Okay.
I can't. No, you're all gurgled. Try again. I cannot. Can anyone else hear Janet? Or is it gurgled? It's gurgled, Janet. Perhaps while we're waiting for that to get fixed, can everyone hear me okay?
Yeah, can we just make sure everybody is in mute? Because that might be a problem, because I see that some people aren't muted right now. Art, you're not muted. So that might fix Janet's problem.
Oh, I'm muted.
Okay, check the microphone again, Art, and make sure there's a red line on it, please. Okay, Janet, you want to try again?
1, 2, 3.
Nope, you're still warbled.
I may change positions and move to a different desk.
Okay, so in the meantime, if you want to forward some questions to perhaps myself and Dr. Kling, that would be useful. In the meantime, I am going to answer a question that I've had several times and heard, which is why are we as the Board of Education not meeting in person? So I just wanted to clarify that at our September board meeting, we plan to meet in person. We're still working. Oh, Janet, can you mute? Because it's reverby. Thanks. Can everyone hear me? Yeah? Okay, thank you. So basically, I just wanted to share with everyone that we will be start trying to do our board meetings in person. We're working out how to do that in the safe way that is recommended for a group meeting with distancing. And trustees will attend in person. Sorry, I have dogs. Some people have kids. Dr. Kling, did you have anything that you'd like to speak to while we have this opportunity of time?
Testing 1, 2, 3. Is that any better, Shar?
No, it isn't, Janet. It's still reverb.
While we're waiting for Janet, I feel like the most common questions that I've heard we've already discussed. Ali or Raina, is there anything that you want to say?
Okay,
Maybe just.
how's that?
That's good. Thank you, Janet.
Okay, is it possible that that door get closed because I can hear it coming back? That was just a little opportunity for us to let our sponsors take a moment to advertise while we were offline. So the next question that I was going to answer was related to windows. Will windows be open throughout the day to promote fresh air? And I would like to draw people's attention to a document that is easily located on our website that looks like that. And that is our safe work procedures. And on page 4 of this document, I'd like to share with you some of the modifications and improvements and upgrades and work that has been done related to fresh air circulation and ventilation in the school district over the course of the summer. So school districts and independent school authorities are required to ensure the heating, ventilation, and air conditioning systems are designed, operated, and maintained as per standards and specifications for ongoing comfort of workers. In order to enhance school ventilation, schools should consider, and we have, moving activities outside when possible, and considering moving classrooms outside when space and weather permit. Ensuring that ventilation systems operate properly. All air filters have been changed in August in preparation for the new school year. We have increased the air exchanges by adjusting the HVAC systems. The Facilities Services Department will increase the minimum fresh air intake for all classrooms and the capability for the adjustment. Opening windows when possible, if weather permits. Windows are all checked for safe operation. And the next question, if our kids are enrolled through distance education, do they lose their spot at their school? Why can't they keep their spot? It's not fair to them. If anything, it almost seems punitive for them to lose their spot. And respectfully, Denise, I understand where you're coming from and I can appreciate your concern. However, we don't make the rules. Every student has a 9-digit personal education number. And when that personal education number is used at a school like Sualax, and then another school like the Distributed Learning Program, North Coast Distance Education, attempts to register that student with that very same PIN number, they clash in cybersecurity or cyberland, and it cannot happen. Students cannot be enrolled in 2 schools at the same time. It's not a punitive action. It's a necessary action for the Ministry of Education to do their student enrollment counts and provide funding based on student enrollment. The last question from Denise, why isn't there a 4th option that allows students to learn distantly from home, not losing their spot and maintaining some form of connection with their class? And that is now available in the transition program. For students who can participate in distance learning with a connection to the class for specific days and times. And again, unfortunately, that is not an option for us, given the mandate that we have been charged with the responsibility of following. Question from Eliza. If a student exhibits any symptoms of being ill, what is the protocol regarding parents picking them up? What if the parent can't pick them up or chooses not to? What will happen then? Who is to care for the student? Well, if a student, first of all, I'd like to, before I answer that question, I would like to take the opportunity to emphasize the importance of the pre-screening or the daily assessment that parents do with their children prior to sending them to school on a daily basis. And Dr. Kling, if you wouldn't mind weighing in on your thoughts around this issue. But to answer Elisa's question, if that happens, then the school would have to have a conversation with the family around accurate demographic information that would allow us to contact them and put their child in a safe environment at home, not isolated in a school wearing a mask.
Yeah, and just to agree, it's so crucial that families do these symptom checks before leaving the house in the morning, and just erring on the side of caution and staying home if there's any hint of being sick.
Contact them and I'm sorry, I got 2 things going on. I don't want this on. Safe environment.
Jen, you have 2 lines open, so you're on Zoom twice. So that's your problem. You're on Carol Gagnon and you're still on Janet Meyer, maybe that's why. Dr. Kling, would you mind just elaborating on what that morning symptom check-in would be for a parent, please?
Sure. So there's a wide variety of symptoms that could possibly manifest as COVID. And you can check the BC CDC website. There's a lot of various sources where you can go through all those symptoms. Should be, checklists that you can print out if you want to go through that every morning. But just to be careful to go through the full list of symptoms. COVID manifests in a wide variety of ways, from a mild stuffy nose to, fever, fatigue, feeling unwell, and everything in between. We're seeing a lot lately that even just, that symptoms of just loss of taste and smell are very, specific to COVID-19. So yeah, symptoms can be subtle. So just encouraging parents just to, watch carefully for any signs in their children.
Thank you. Janet, are you back on?
Thank you for covering. Thank you for covering for me. The next question is, if staff exhibit any symptoms, what is the protocol? The protocol for staff is the same protocol that exists for students. Are they sent home? And if so, for how long? I can answer that if they're required to go home, the answer is yes. And for how long, I will defer to Dr. Kling.
It's exactly the same advice as for children. If they get a test and it's negative, then as soon as they're feeling better and okay to go back to work, they can go back to work. If there's no test, then they need to isolate for 10 days.
Thank you. I'm looking at the time, recognizing that we allocated 1 hour for this meeting. I still have an abundance of questions that are available to me, and the 3 pages that have been delivered to me from the YouTube chat. So I would like to consult, looking for a nod of confirmation from the board chair to extend the meeting for another 15 minutes.
I would check with our Northern Health friends first and our DPAC to ensure they would be okay with that. And it sounds like perhaps we won't get through all the questions. So maybe we could do an FAQ and put it on our website as well. So we can maybe extend it 15 minutes if other people are available for that. But if not, then we could do, Rachel's saying yes, Dr. Kling, NH people. Yes, okay, thank you. So let's do 15 minutes of questions and then maybe defer the rest of the questions to, we can do a Q&A document that we can put on our website for further information for parents. Does that sound fair?
Thank you very much. The next question is, high school going to the quarter system means information is going to be given to students at a rapid rate. How are students with disabilities or require extra help and support going to get supported? If a child already needs help and is not expected to take an academic course for a half day, 5 days a week, who and what is in place to help them? A lot of students would be overwhelmed by this. Will they be given an outlet? Are there going to be more breaks throughout the day? That is a long day otherwise. That's a great question. Thank you for posing that question. Students who are identified with unique needs have what's called an individualized education plan. And within that individualized education plan, there are goals, there are objectives, there are measurable targets for students, and there are adaptations or modifications that can be made to any student's program who is on an IEP that will allow them to experience success. So all of the adaptations that we put in place for students with unique needs in what we may consider to be normal time will be considered and put in place during COVID-19 on the quarter system as well. Are the younger students going to access books and toys? Will they be shared? How will the toys be cleaned and how often? That is a great question. It sounds like a simple question, but for principals, vice principals, and district staff on this call, we all recognize that it's not quite that simple. The answer to the question is yes. Students will have access to books, manipulatives, gym equipment, and other things. What our plan is to do, let's take gym equipment as an example. When a class, a cohort goes to the gym, hand hygiene before, hand hygiene afterwards, engage in the physical activity that involves the utility balls, if you will. And that cohort, because they are not required within their cohort to physically distance, can engage in that activity as normal. At the conclusion of their gym class, they exercise good hand hygiene, and the materials that they use during that class are put in what we call the dirty bin or the used bin. And that bin is set aside and no other class engages with that with that set of equipment for the remainder of the day. And at the end of the day, the custodians have new, I want to say new fancy pumps that they spray and they sanitize all the gym equipment in the evening while after the students leave for the day. That is also true of manipulatives and as well as books. Now, books are very interesting because some books are paper and there is no evidence that COVID-19 exists on paper. However, if a book has a shiny laminated cover, that book must be cleaned in between use unless the individuals are from the same cohort, but certainly cleaned at the end of the day. Okay. Will masks be supplied by each school for those teachers who are immune compromised? Masks will be provided district-wide for any child or adult who so chooses to wear one. And the next question is, how are schools going to support villages and bands that may not be allowed to return to school? Students may not return to school due to movement restrictions put in place on each reserve, meant to keep elders safe. Agnes Casgrain, the Director of Instruction for Indigenous Education, and myself have met with all 10 of our bands, and we have engaged in conversation with each band in terms of their expectations around the students and the families and the choices that they make. And every band has a different scenario. And we will accommodate the requests of individual bands as they are requested. So for example, we have had conversation with individuals from the Haisla Nation. And we have had discussions around providing support in community to students whose families determine that it's not appropriate for them to return to school. So we are engaged in conversations to support each band in potentially 10 unique ways. It's possible that we intend to send school personnel in community, in villages on a scheduled basis to provide face-to-face support. A question, I would like to know why more flexibility is not being offered. And again, I'm going to save us a bit of time, and the answer to this question will be the Learn from Home transition program. And at the end, it says, also, I'm being told that if I start the year out distance learning and then decide to change for whatever reason, I can't be guaranteed there will be space available for my children. That is true. That is true. Question, I would like to know why your meetings are still being held via online and yet you are expecting our children to go back to school. Well, I could interpret.
I addressed that already when you were not on, Jen.
Thank you.
Yeah.
If I send my children back to school, who do I hold responsible when they get sick? And that question was asked earlier, and I responded by saying that I certainly, as a superintendent, am offering you no guarantees, and we have addressed that. Why has there been little to no effort put into the procedures? For example, washrooms are only being cleaned twice a day. The BC Centre for Disease Control and the document entitled Health and Safety Guidelines for COVID-19 are two documents that would be very, very valuable for people people along with this person who composed this question to read through. If you go through the BC CDC guidelines, you will notice that every single one of our school plans, as well as our district plan, are in compliance with every single recommendation or mandate in those documents. So we are cleaning our schools twice a day as per the BC CDC guidelines. Are there new hand?
Does anyone from Northern Health want to further comment on that, or are we good? We good?
I just want to further Janet's comment that, you know, we are to expect cases of COVID in school. There, you know, it will happen. We don't know whether it'll happen in your school or not, but we know full well across the province there will be cases, and we just need to expect it. And, you know, there's no responsibility. You know, we want to hope that everyone is taking all the right steps and to stop COVID and to prevent the spread. And yeah, we just have to be prepared that it might happen, that there might be cases.
And Dr. Kling, I'm just wondering if you
think.
could, if there were a case in the province, not in Coast Mountain School District somewhere, is there a specific consistent process that the health authority in that region follows when there's a case in a school? I know further down in the list of questions, there are questions around what are we going to do when and if there is a case. Can you outline the process?
Yeah, absolutely. So when there is a confirmed case of COVID that's lab confirmed, that gets reported to us in public health, you know, very quickly. And then the first thing that we do is we reach out to the case and ask them to isolate and take a history so we can understand, you know, first of all, how sick they are and if they need some further, you know, clinical support, and then to do contact tracing. So we need to understand where the case was, where they've been, what they've done, who they've been in contact with, so we could understand the risk. So then we can go about working with the school to ameliorate any of the risks. And so, you know, some of those steps might, you know, it'll likely include having to isolate some people that the case was in contact with. Who we need to isolate will depend on the specific situation. In some situations, we might have to isolate an entire learning group. Some situations we might have to isolate more, and there might be some situations where we might just need to isolate just a few close contacts of people that were just most directly connected to the case. And so, yeah, our plan is to work closely with a whole range of people to respond to a case.
So am I correct in saying that in the response to a case of COVID in a school, it would be managed by the health authority on a case-by-case basis?
Absolutely.
Thank you very much. And I see that we have 1 minute, so I'll do one more question. I was wondering what kind of PPE will be provided for teachers in our district, and that answer is the hand sanitizer, the additional wash stations, the masks, and the shields. I'm thinking specifically about arts education teachers who will be rehearsing with students in a band classroom where 2 meter spacing will not be possible. The BCMEA, which I'm assuming stands for the BC Music Educators Association, has recommended that bands rehearse in larger spaces other than classrooms. And where this is not possible, teachers should have PPE such as masks and face shields. While we don't take direction from the BC Music Educators Association, I believe that we are adhering to their recommendations. There was also a suggestion of covers over the bells of the instruments to reduce the amount of water droplets that expel from the instrument. Are there some funds from the provincial government going to be allocated for these recommendations? Well, we have, as I stated in my opening, already spent the provincial government's allotment for our COVID planning. Granted, today it was announced by the Honorable Rob Fleming that we have been allocated additional federal funds that are to be spent in a variety of categories. And the way districts spend that money is determined on a district needs basis. And that need is determined on a district by district basis in consultation with partner groups. So I would love to hear more from Fiona related to
musical instruments in the near future. So looking at the time, I would turn it over to Chair McCrory for some closing comments, if you wish.
Thank you. I just want to check in with our partners to ensure that they don't have any final words. And if they do, we will give you the time to do that. So I'll start with DPAC, who's saying no, and Northern Health, Dr. King or Dr. Fumerton or Ali. Okay, great. Well, I would just like to say that I hope this evening has provided some clarity to parents and students and guardians for going back to school. And I have to tell you, I just did a quick glance to make sure I was unmuted because that's always the thing. Are you on mute? So I hope that we were able to provide some clarity, and we appreciate everyone who has contributed by submitting questions to us earlier on our COVID email, as well as through this live feed on YouTube. And those questions that haven't been answered, we will do our best to answer all the questions that have come in. We will do our best to share that information through our websites, school websites, and Coast Mountain School District 82 website, as well as email it out to those that have asked the questions. And we hope that if you have more questions, that you still feel free to submit those to the emails that we have within the school district COVID email, or anywhere. Phone your school if you need information, email your principals. We want to provide the safest environment possible for all of our students, and that is the intent. And we feel very confident that we are doing that. So in that, I would like to thank all of our participants this evening, especially our community partners of the District Parent Advisory Council, Rachel Pozo, our Northern Health people, Dr. Fumerton, Dr. Kling, and Ali Moore. Thank you so much for your participation this evening. And of course, thank you to our superintendent for helping us through this evening as well. Thank you, Janet. And be safe, everyone. And thank you so much.
Thank you, everyone.
Bye-bye. Good night.